Bismillahirrahmanirrahim. Assalamu alaikum, everyone. This is Dr. Sundus. And in this session, we will be discussing one of the communication station. And without wasting further time, I think we should move on to the case so that this session will remain short, comprehensive, and brief. So we have our active participant with us. I think she's here. Yes, she's here. Please unmute yourself.
Yes,
Dr.
yes,
Vaswani, can you hear me?
yes, Dr. Sanders.
Okay. Uh, your voice is not very much clear. Can you please say it loud?
Yes, doctor, is it, you know,
Okay. Keep your mic close to you.
okay.
Okay.
Is
Is
it
my
clear?
voice clear, everyone? Please give me a chat so that we can start our session. Is my voice clear to everyone? Okay, great. Great. Okay, so the purpose of today's session is just a little bit preparation and a demonstration of one of the communication station, which is really important in exam. As you can see that you will face this communication station on two proper stations, right? So, Dr. Vaswani, this is your objective or your task for today. I'm giving you 3 minutes, although you will be given 5 minutes in the exam, but I'm giving you 3 minutes to prepare yourself, and then we'll be having a proper session. Okay? So go
Okay,
ahead.
okay.
Doctor, are you ready?
Yes, Dr. Sanders.
Okay. So, Dr. Vaswani, I will advise you to keep your mic very close to you so that we can hear you properly. And I'm setting a timer for you. So let's start, Doctor.
Good morning. My name is Dr. Vaswani, and I'm one of the doctor in the medical unit today. Am I talking to Miss Mary, 30-year
Yes,
old?
doctor. Yes, doctor. I'm Mary. I'm staff here.
Okay, Miss Mary, we are here to discuss regarding your health condition. Is that okay with you?
Yes, doctor, but I'm not in a good state. I'm very much panicked, and you can see that I'm crying as well, right? So I don't know. How did it happen all of a sudden?
Yes, Miss Mary. Please calm down and have a seat. You can use
Thank
these
you,
tissue
doctor.
papers. Are you fine now? Can we talk about it?
Yes, doctor. I need your advice. I'm very much stressed out. Please help me.
Yes. Can you please tell me what exactly has happened, Miss Mary?
Yes, sure, doctor. I mean, I was just taking the blood sample from a patient. You know, the patient who is HIV positive. I know he was HIV
Mm-hmm.
positive, and I was taking a blood sample, and then patient just moved his hand, and that needle got stick to my finger. I have got a prick. You can see here, right? And I'm just panicked that how did it happen? I was so much cautious about this, but I don't know what to do with it. Now, he was a confirmed case of HIV. What will I do?
Okay, Miss Mary, please calm down. We all are here to help you out in this condition. I can understand how much worried you are in this position. Anyone at your position would have reacted in the same way. But please be reassured that our whole team is with you in this difficult time. We will help you out in this in every possible way. Okay.
Thank you so much, doctor.
So I would like to ask you a few questions, Miss Mary. Is that
Yes,
okay?
yes, doctor.
So you told me that you were taking sample from the HIV positive patient, right?
Yes,
So before that, were you wearing gloves?
Yes, doctor. I was wearing two gloves,
Okay, okay, that's
double
fine,
gloves.
and that's a good thing. Okay, very nice. So the needle that got stuck in your finger, what was the size of that needle? Was it
Doctor, it was
wide
thick.
or
It
is
No, it was thick, and
it was?
it got deep.
Okay, it got deep. Okay, okay, no problem, Miss Mary. We are here with you. So
Hmm.
after getting that stuck, what did you exactly did?
I removed the gloves. I washed my hands, and I squeezed out the blood as much as
You s-
possible.
okay, okay, no problem, Miss Mary. We will help you out in this bad condition. So the patient was confirmed with HIV. So was it confirmed already?
Yes, yes, doctor. You know the patient.
Okay, okay. So, can you tell me about your status? Are you immunized with hepatitis B as well?
Yes, doctor. I have taken the vaccination.
You have taken the vaccination. Okay. So, now I'm discussing the plan forward with you. Is that okay? What we are
Yes,
going to
yes.
do?
I want to know.
Okay, so first of all, I appreciate that you were wearing the gloves and you have washed your hands properly after the stuff. But what we are now going to do is that we will send a few blood samples of you to check your immunity status of hepatitis B and any proteins against the hepatitis C in your blood as well. Will that be okay?
Okay.
So again, to look for your status, we will be going to do the HIV testing for you. Is that right
Why,
with you?
doctor? I'm not HIV positive right now. Why you are doing
Yes, Miss. Yes, Miss Mary. I'm not saying that you are HIV positive, but as you have got the injury with this needle stick, although the risk of getting the HIV with this needle stick injury is very low, like it is zero point 0.3 in case of needle stick injury to get the HIV, and it is 3% to get the hepatitis C virus with these sort of injuries, and almost 30% to get hepatitis B virus, right? So the
it?
chances of getting you HIV is very, very low. So be assured of it. But we need to be totally satisfied that you are not having this sort of virus in your blood. So that's why we need to get you your HIV testing. Will that be okay?
Okay. Okay. But
Okay.
uh, okay.
Okay, so first of all, we'll take your sample and send it, and we'll try to get the results in 1 or 2 days. But be assured that the result will be told to you by on face. We will not email you or send you any sort of message. So it
Mm-hmm.
will be totally confidential. Is that
Okay.
okay? Okay. So
Yes. Okay.
the other thing is that in case it comes out negative after few weeks, like in a duration of 6 to 9 weeks, we can repeat the test because there are some chances that the test can be that the test does not show the virus load, and in initial phase the virus is not picked up by the test. So to reconfirm it, we'll test it again after a few weeks to be sure on our side, right?
Okay.
So what we are going to do now at this moment that we will start you on three oral tablets, right? To be safe side, that is called prophylaxis. That will be
Okay.
if there are so many little chances of this virus in your body, but if it, God forbid, it is in your blood, so it will be killed by those oral medications, right?
Okay.
Are you getting me?
Yes. Yes, doctor. I'm on you.
Okay, okay. So other than that, I'll advise you to do few things. Are you married, Miss Mary?
Yes, doctor. I'm married.
Okay. So do you have children as well?
No, not right now. But
Okay, okay,
doctor, I'm 4 months pregnant, and I'm really
okay,
worried about this.
okay, okay. Miss Mary, yes, what we are going to do is we will start you on these oral medications, and hopefully when we get the results, we'll discuss regarding the further plan regarding your delivery. That
Mm-hmm.
what sort of mode of your delivery should be,
Mm-hmm.
and once the test comes back, we'll discuss it with your women health doctor as well. We can involve her, and also the infection control doctor will be involved in this phase, right?
Okay, doctor,
And
but I'm worried that the tablets you have mentioned, are they going to hurt my baby?
okay, so I truly understand your concerns. So before giving it to you, I'll reconfirm it from my consultant. But most likely they are not going to harm any of your
Okay,
pregnancy.
okay.
Okay, and I'll advise you to have
1 minute remaining,
safe
doctor.
sex in this period until we are confirmed about your status. Okay,
Mm-hmm.
until we are confirmed about your status.
Mm-hmm.
Okay, and other than that, I'll advise you not to share your personal belongings with anyone. Do
Okay.
not take any of the do not give any of the blood samples to anyone. Do not share your blood until we are
Mm-hmm.
confirmed regarding your
30
status. And
seconds
if
remaining.
necessary that you are going for any test, then you have to disclose it. Okay, so is there any
Okay.
other concern, Miss Mary?
Yes, doctor, can I continue my job?
Do you have any other concern?
Can
Yes,
can I
yes.
continue
Very
my
good
job?
question, Miss Mary. So, till now, yes, Miss Mary, you have to switch the type of activities at your job, but you can continue. We will involve the occupational health worker that will adjust some change. That will do some changes in your job that you are not exposed to the persons, right? So you
Okay.
can work in the hospital, but you are not exposed to to the
Your time is
patients.
up, doctor. Your time is up. But if you want, I can. I was having a few of the other concerns that I want you to answer me, right? So we are
Okay,
continuing our communication, although the time
okay,
is up. Okay.
okay,
So the other concern is, doctor, please keep it confidential from everyone. Can you do it for
okay,
me?
okay. Okay, yes, Miss Mary. So until now, as we are not confirmed regarding your status, so it's truly confidential. As I already mentioned, that the results will only be disclosed towards you, and it will be confidential. But I would like to advise you to disclose once you get the results, to disclose it with your partner. That will be really helpful and supportive for you as well. And in any case, he know after by through someone else, so that can be a problematic. So, but it's up to you.
So, doctor, you are telling me that after 2 to 3 days, I'll get the results of HIV, and
Yes,
after getting the results, I need to discuss the results with my husband if it is negative or positive, as it will
yes,
show as it will show my actual status, like I've been transmitted this virus or not.
yes, exactly, Miss Mary.
Okay, so once the so I understand that uh, you are saying that once the results of HIV that will be disclosed after 2 days is negative, then I'll be negative, right? I'll be free.
Miss Mary, this is not 100% true that if once the initial results are negative, that you are not having the virus. We need to do the test again after around 2 to 3 months, because in initial phase the virus is not most of the time virus is not picked by the test. That is called a
Okay.
false negative test, right?
Okay,
So
so I understand, doctor, that you are trying to tell me that after 2 days, I'll get the
Mm-hmm.
results, and this might be positive because of the transmission of virus to the patient.
Mm-hmm. Yes, Miss
Is
Mary.
that okay? Okay. And there are other concerns as well. Doctor,
Yes.
um, can I think for some time before taking these pills? Because, I'm pregnant and I don't want to start these pills right away. The pills, the medicines that you were taking, that you were talking about. So if I want to delay it, can I delay this medicine? And I mean, after 2 days, I'll get the results. And can I start those medicines from that time?
Yes, Miss Mary, I truly appreciate your concerns, and I can see that you are worried for your baby. But let me tell you that actually these sort of tablets are given within 72 hours after the
Mm-hmm.
exposure to the blood.
Okay.
So yes, the risk to the baby is minimum. Further, I'll confirm it with my consultant, but
Okay.
it should be given within 72 hours.
Okay. Great. Great. Okay, doctor. I'm happy that you have consulted.
Thank you so much. If there is anything else I can help you with, or I can provide you some vouchers to
Mm-hmm.
see the details of this virus and the tablets and the
Mm-hmm.
management plan. And
Okay.
I can provide you the hospital websites and
Mm-hmm.
our contact number. In any case you have any queries, you can consult with us.
Thank you. Thank you so much, doctor. Okay. So, how do you feel, Dr. Vaswani? It was good.
So,
Yeah.
okay. Okay.
Okay. So we have people here, like I think apart from me and Dr. Vaswani, we have 16 candidates here. I'm just going to show you. Let me show you, and then we'll discuss. Okay. I'm just going to show you the mark sheet that all of you who will be appearing in PACES will face it. Okay. So these are the skills that will be judged or assessed on this station, right? So I want everyone to give comments or to give a score to Dr. Viswani. I know she has done very well, and this is the station, this the needle stick injury. I mean, this is the lengthiest communication I've ever come across. Okay, so I know there are many things that you need to discuss, but we are already short of time for this. So we need to discuss as much as possible, and we need to discuss the concerns of the patient on the top. So I'm giving you 2 minutes, everyone. You need to assess clinical communication skills. Although this is the sheet, I mean the two of the examiners will be having. So each examiner will give 8 marks, right? In total, out of 8, they will give each, right? And you will be facing two examiners on this station. So the station will carry 16 marks in total. So how much marks you will give to Dr. Viswan? First is clinical communication skills, explain clinical information clearly and the management options as well in a professional and comprehensive way, assesses the impact of symptoms and identifies patients' preferred management options. Then, regarding the judgment, then patient's concerns and maintaining patient welfare. In the chat box, out of 8, you will give the marks, okay? Quickly, we are waiting. Okay, Doctor 7, I'm not disclosing the names. Okay, the candidates can text me as well. I mean, not on the chat box, not to the everyone, but to me if they don't want to disclose your identity. Okay, 8 out of 8. Okay, 11. So we are not giving the marks for two examiners. We are giving a single one. So the maximum is 8. Okay, great. So you are getting good marks. Very good. Great, great. Okay, if I'll assess you, Dr. Vaswani, about the patient's welfare, that was good. You have shown much of the empathy sympathy. Your tone was quite humble, polite, and low, and you have listened to her as well. So, patient welfare would be two. Then, maintaining patient's concern. Okay, so you have tried yourself best to maintain the patient's concerns, but the concerns were, because of the time issue, there were some
Time issue,
concerns left.
yes.
So, examiner might give you borderline in this, although you have, talked about the concerns that she has shown, but there could be some hidden concerns. So for better assessment, I mean for better marks, you need to have at least 2 minutes or 1.5 minutes for the concerns asking and management. Okay, so some of the examiner can give you borderline in this. Okay, clinical judgment and communication skills. Your communication skills were very good. You were professional. You have tried your best to not to use jargons, although she's a staff, but sometimes there's a junior doctor as well, right, as a surrogate. So still, you need to avoid jargons. Um, you have mentioned the word immunization or immunized. You have used the word the immunization or immunized, right? So don't
Yes.
use it. You can say that are you vaccinated or have you taken any vaccination regarding hepatitis B? Okay. So this was the thing, and then the word of tablet was there, so you can replace it by pills. Okay,
Yes.
so this can be a jargon. Virus, yes, you can use, but if you can say it like a bug, so that will be more preferable. Okay, so keep it simple and in a layman term. Otherwise, your clinical communication skills was all right. Then clinical judgment. There were few things on which I can give you borderline because about the testing, I thought the concept of testing was not very much clear, and that we need to discuss right now. Okay, Dr. Vaswani, is there anything else? If I mean, if I'll give you some time, is there anything else that you want to deliver?
Yes, I
Any other
forgot
information?
to mention about the incident report that we usually
Good,
take at
good.
these things.
Yes, yes. And so, if she will start treatment right away, and after how much time she need to come back?
After 1 month, I guess.
After
1 month.
1 month. So, in between this 1 month, if anything happens, then
Yeah, yes.
yeah.
So
So you
if
need
she
to warn
gets any
about.
side effects, we ask her to
Yes,
come back.
yes, yes.
Yes,
Very
yes.
true. So that was a good, good information that you can deliver, right? Okay, so that was a good attempt, Dr. Vaswani, and I hope that after if you do the things like way, I mean in the same way in the exam, you will definitely get 6 or more marks because of your tone, your humble attitude, and your selection of words and information. But you can add up some of the more interesting and more concern information in this communication. Okay. So thank you so much. You can mute yourself and we can discuss some of the important points in any case of needle stick injury. Okay, first of all, you need to introduce, as Dr. Vaswani has introduced in a way that we all introduce in any of the station. You can do it in this way, or you can do it like, hello, good morning. If you want to, greet, good morning. This is for example, if I'm doing this, this is Dr. Shafi, one of the doctors in clinic today. You must be Miss Mary, your staff in our ward, because sometimes if you have a colleague or a staff or a junior doctor with you, then it sounds weird that you're asking what's your name or are you this, right? So because you know him or you know her, right? You are seeing them on a daily basis, so you can start in a frank way. You must be, or yes, Miss Mary, what is your concern? I'm here to help you out, right? You can call in that way as well. So first thing this, second thing, the HIV patient was admitted in your unit and you were duty doctor, so you know the HIV patient because she has also mentioned that there's a patient, doctor, he's HIV positive, and I got the needle stick injury from that patient. But in the communication, you asked that is the HIV status confirmed? So it depends what's in the scenario. If the surrogate is saying that you must have known this patient, so that means that you know this patient, right? You don't need to repeat this. Okay, then don't use the word that will create fuss. Like she's already panicked. I think in communication, the word that was used was a bad condition. I know this is a bad condition for you. So don't use these type of words that will cause more panic to her, right? So you have seen that that the surrogate is panicked. You need to greet. Then you need, as the Dr. Baswani said, that please have a chair, sit down, relax. Can I give you a cup of water, glass of water, right? Do you want water? Something like that, right? Offer help. Okay, relax. Tell me what has happened. Is there anything that that I can do for you? I'm here to help you out. As she has, already mentioned, you can do it in your own way. So initially show empathy, very important, right? Then, as it's already been done, that ask for safety measures taken before the blood sampling. So I hope everybody has an idea that double glove method should be used, right? And HIV status is confirmed and all. Then, so this is before, right? Then in this before sampling, you can ask about the vaccination status as well. Okay, then in between, I mean, what has happened? The type of needle, size of needle, depth of penetration, amount of bleeding, exact time of contact, right? And then safety measures taken after this incident. Do not scrub, just squeeze, wash with soap and water, right? Remove gloves and all. Then you ask for previous vaccination of hepatitis B. Then you need to explain the transmission risk. You can give the estimate or the exact percentage for HIV, Hep B, and Hep C, as our candidate has already mentioned. Then explain. Okay, now right here at this point, you will again show empathy, sympathy. Might be she's crying, so you can offer some tissue, some water, and get her relaxed, right? Then explain post-exposure prophylaxis. Now, either use this word, but along with some layman terminology. These are the pills that will be given to you, and these need to be started within the 72 hours of contact for better outcomes, right? So then she will ask about the pregnancy. So then at that time, you can say that, okay, if you're pregnant, then we can alter your medicines and we can give you the type of medicines that are safe in pregnancy. Okay. So post-exposure prophylaxis in general is different, and in pregnant women, it's different. So you can offer the PP for pregnancy, right? And for that, and even before this PP explanation, you need to say that, okay, we need to report this incident to the HR department and occupational health department as well, so that they can help you out. And for PP, you can even involve infectious diseases department. And for example, you and she is on call, right? So you will get this PP starter pack from the emergency department nurse. Okay, so you can mention that as well. Okay. Now, in case of any side effects of the medicines, you can, if you are short of time, you don't need to mention any side effect. You just say, in case of any side effect of the pills, you'll need to come back. Or if there are symptoms of seroconversion. Seroconversion, you will not use the word of seroconversion. You will say, if you have symptoms of fever, lumps and bumps in the body, or any rash, then you need to come straight to the hospital. Okay. Then this is an important thing that was actually missed in the communication. Explain the need for blood tests for viral infections. We are not doing this test for the status of transmission. We are doing Hep B, Hep C, HIV. For what, Dr. Vaswani? What's the primary objective of doing these tests at this moment, at the initial moment?
because of iris sort of thing.
Okay, we are actually doing it for claim purpose. Okay, if the transmission is there, she will not get it positive in 2 days. Okay, you are doing these tests to make her negative at the baseline, right? Because you are sampling from her right away, right now, right? You are sampling at this point, at the point of contact. So this negative report of Hep B, Hep C, and HIV will prove that she was negative beforehand, before the contact.
Okay.
Okay, and if in any case she'll be positive in the subsequent labs, then it will be proven that this is due to the contact. So she will be eligible for industrial injuries disablement benefit. Okay.
Okay.
So for claim
Okay.
purpose, you are doing right away for claim purpose to see that she's clear from the viruses right now. And if anything is positive after a month or 3 months, then it's due to the contact that has happened today. Okay. Then you have done, you already did you have already taken the sexual history and the need of safe sex and all. And the last point was also done very nicely. Okay, about the confidentiality, you can say that yes, it will remain confidential, but we need to involve some of the departments or some of the people from the hospital, the HR, the occupational health department, and sometimes the infectious disease and the consultant as well. Because your consultant will know, right? You're in charge of the ward, should know that this has happened so that they can put you in a low contact area. If she is still on duty and she is sampling, like taking blood samples from the patients, and somehow after 3 weeks or 4 weeks, she is HIV positive, and she is in contact of the patient, she can transmit. So she can be shifted for some time in the low contact area, like on the office job or on the data entry job, so that she'll be away from the patients, and in this way you can reduce the contact. Okay. One thing that was really good, I don't know, I'm not, I cannot recall at what point, but she has mentioned that I'm not sure about it. I think for the PEP, I'm not sure about it, and I'll ask the consultant regarding this. This is a really good point and a really good step. I mean, they are not, you know, they are not asking, or they are not very much concerned that you know each and everything about the condition, right? This is a communication station. So they are just assessing you on the basis of your skills, on how to interact and how to judge and making a smart decision and maintaining patient's welfare, if you can see the skills, right? So if you don't know anything, please do not transfer wrong information. It's smart to address it in a way that, okay, I don't know at this point, I'll look into this for you and I'll let you know as early as possible, or I will consult the senior person or consultant in this domain, and then I'll let you know. Okay. So important thing is that, Dr. Vaswani, you need to be quick. If you have extra 1 or 1.5 minutes, I'm sure that you would have completed all these aspects that were left behind, right?
Yes.
Otherwise, there were no major issues in your communication, and it was really nice and smooth. The important thing in communication station is those 5 minutes beforehand, right? When you are in the resting phase, you get 5 minutes and a paper and a pencil and a scenario. You need to utilize it in a very proper way. You need to write down the steps, the pointers, right? For example, if you get this needle stick injury, first of all, you need to decide whether it's needle stick injury, refusal of treatment, DNR, withdrawal of treatment, or the topic is about anything that is related to breaking bad news. And then you need to align these pointers accordingly, right? Write down the name, the age, or of the patient, and is there any attendant that is available, right? But in cases of of the diseases or things that where confidentiality matters, you will not ask about anyone to accompany that patient or whoever is there, right? And then write down the points, like in this needle stick injury, you can write down the name of Miss Mary, right? Then you can write down details happened during the incident. First point, you will ask measures taken before sampling, During sampling, what happened during sampling? Measures taken after incident, right? Previous vaccination, transmission risk, PEP, side effects of PEP, symptoms of HIV, then safe sex, any concerns, need of blood test. So these are the points that you will write down beforehand. So you will not miss anything which is very important. But always remember when the examiner will give you a call of 2 minutes, just summarize your whatever you are saying, just summarize it and take 1.5 minutes for just sharing for just managing the concerns, because concerns have got another the separate skill in each station. So this is important thing. Okay, I hope everything is clear to everyone. I'm not going in details at how you will do the testing for Hep B, Hep C, because then this will be a long session. And hopefully, I'm planning to do needle stick injury in Hep B, Hep C some other time. So anything that you want to discuss, you can discuss in chat box. Anything related to this communication station. Okay, why we are doing hepatitis B and C in this patient? Because whenever the patient is HIV positive, you don't know if you are talking about okay, there are two different aspects. The first aspect is that the staff is in contact of various patients, right? So we are doing hepatitis B and C status of the staff first, right? Because might be possible that after some time she's Hep B or Hep C positive, and she will claim that this is due to needle stick injury that has occurred, years ago or months ago. So first of all, you need to clear the staff that is she Hep B, Hep C, HIV positive or negative for the claim, because in UK, this claim will be done if she's negative for the viruses and she'll become positive after some time, right? Only then she can claim for disablement benefit. Okay. The other aspect is regarding the patient. If the patient is HIV positive, there are chances still that he might be, Hep B or Hep C positive, right? And sometimes it's okay. I was not, I was not planning for this topic, but okay, as a question has arisen, so I can give you an answer. So if the patient is Hep B, Hep C negative and HIV positive, the debate is over, right? You will only do Hep B, Hep C, HIV in the staff, and that's it. Nothing is related to the patient because he's clear about Hep B, Hep C, and he's positive for HIV. But for example, the HIV test is positive and Hep B and Hep C is unknown in the patient. I'm talking about patient, right? Not the nurse. What will you do? Now you are doing Hep B, Hep C, HIV in the nurse and she is negative, okay, at the baseline. But how will you know that patient is Hep B and Hep C positive or not? Because the status is unknown. It was not done before. There were no symptoms or whatever the reason was. So how will you proceed for this? This could be a concern as well. The doctor, HIV is positive in this patient. So I'm taking PP for HIV. But what is the risk of hepatitis B and C? I mean, it's unknown in this patient. So what should I do for that? Will you do hepatitis B and C in the patient who is unknown right away? Or what other thing can be done? Okay, Dr. Baswani, do you have any opinion regarding this?
I couldn't get the question. Can you repeat, please?
Okay, okay. For example, the staff is negative for Hep B, Hep C, and HIV at this point, right? And we are talking about the patient who is HIV positive. But the staff
Yes.
told you that Hep B and Hep C in the patient is unknown. You don't know the status of Hep B and Hep C in the patient. So what will you do? And she is concerned that might be possible that the patient is Hep B, Hep C positive. So will you test the patient for Hep B, Hep C?
Uh, we can after taking his consent and then.
Okay, that's great. So we can do this, but not in a very simple way. Why are you testing patient? Okay, you will go for taking consent. First of all, who will go for the consent taking? You will go, okay, or any other doctor will go, not the one who is pricked. The staff or the junior doctor who has got needle stick injury will not go to the patient and will say, okay, I get the needle stick injury from you, and now I need to do hepatitis B and C testing in you, right? So she will not go to take consent either. Although in this scenario she is a nurse, she will not go for consent. But you may face a scenario with a junior colleague. So that person who has got this injury will not go for consent taking. Okay. So who will go? You will go, or the other person. Okay. Any other person will go for the consent. Now you can explain the patient the actual situation, right? Because you cannot take a consent in a hidden manner. Okay, we want to do your test. What is the indication? You need to see that what is the indication, right? If the patient says, okay, do my testing, then do it. If he refuses, then you can't do that. Is that clear? Right? If there's no consent, you cannot send hepatitis B or C test in your patient. What you can do is that you can counsel the nurse or the junior colleague who has got needle stick injury that we will repeat your test of hepatitis B and C in a follow-up way, like in the 3 months and 6 months period, as with HIV. But right now, what we can do is at the baseline, at the day one of the contact, we can send HIV, Hep B, and Hep C. And if the staff is vaccinated or immunized for hepatitis B, we can test the immunoglobulin levels. If they are low, we can give the booster shot. If she is not immunized, then we can give the immunoglobulins along with the vaccination right away. That's what we can do. We cannot do anything for hepatitis C, and we can give PP for HIV. Is that okay?
Yes, Dr. Samas.
Okay. I hope everything is clear. We are keeping this lecture short. Uh, so I think there are no more queries. If you have any queries, you can, text me in person. So I hope you have enjoyed this session and you must have learned something. And if you want to continue these free sessions or the courses, you can contact me so that I will get, more motivation regarding this, and I'll plan for such sessions in future. Um, this is it for today's session. Allah Hafiz and take care.